So measurement of mortality means mortality data has a primary foundation for epidemiological research, right? So mortality means death. So here we like to tell you about international death certificate or a national death certificate, right? So death certificate is the cornerstone, and to ensure national and international comparability, we have a standardized format. So number one, in this format, that the certificate should have immediate cause of death registered. The underlying cause of the death should be written. And second part should be the contributing factors, the risk factors, underlying causes. These all should also be mentioned in the death certificate. And this is the format of international death certificate. Okay. What death certificate we use in India? We have just a contextual detail that this is the name, this is the father name, this was the cause of death, or maybe certain uh, in certain states the cause of death is also not written. Okay, so the person's name and the timing and date is written on the death certificates. That's it. Now we are talking of mortality data. Now, what are the uses of mortality data to the epidemiologist? So it plays a very critical tool. It explains the trends, it explains the disparities, identify prior health issues, identify the priority health issues which should be taken into consideration, design and evaluate the intervention programs, and monitor and assess public health policies and outcomes, so that the hypothesis can be generated and we can have certain strategic guide for future planning. But what are the limitations? Limitations are deaths are not reported fully. There is lack of accuracy. Lack of accuracy means yes, the medical certificate do not have the correct cause of death. Okay. Lack of uniformity means there is no standard way of gathering the data. It is compared, if we are comparing it between countries, between regions of one country, there also the problem is there. Then choosing a single cause of death. Now, if it's written the CVD, like cardiovascular disease से death हुआ, तो how, what were the risk factors? What was the actual causative thing that occurred, which was the main cause of mortality, right? So like if you can say the hypertension, means CVD can be caused, CVD death can be due to hypertension. It can be due to failure of certain valves, means valves are not working. So these particular things are not written in the death certificate, which again give a very rough idea about the things happening in the population. Changing means evolving diagnosis trends, coding systems, these are all different. So we require standard terminology. So here I would like to tell you that there is ICD uh, 10. ICD means International Codes of Diseases, where there is the standard terminology which is uniform worldwide. Okay. So diseases with low fatality means sickness is there, mental illness is there, arthritis type of disease is there, but there is no fatality, means there is no mortality occurring due to these illnesses. Though they can be the risk factors, but these are directly not the causes of death. So here, low fatality rate diseases are not considered or not recorded. So these are limitations of mortality data. Now, if we talk of mortality rates and ratios, I'll come quickly to certain death rates which we have to study. Now, these are if the question comes, what are the mortality rates and ratios? You will just say that mortality rates or ratios are used to measure the frequency of death in a defined population over a specific period of time, right? And there are certain death rates that we have to study. Like one is crude death rate, means number of deaths during the year and what was the mid-year population into 1000, right? Specific death rate, like if we talk of tuberculosis, number of deaths from TB during the year upon mid-year population into 1000. Then case fatality rate or ratio, total deaths due to a specific disease upon total cause cases of the same diseases into 100. Like if we are talking of food poisoning or cholera or measles, then CFR is taken into consideration.
Ma'am, just wanted to ask, it is 100 or 1000, ma'am?
So, proportional mortality rate, if we are talking of disease specific again, so deaths from a specific disease upon total deaths into 100. Under 5 PMR, under 5 means under the age of 5, the infant or the children under the age of 5. Then what are the deaths happening? Total deaths in same period into 100. PMR, like age of 50 plus, how many deaths? Total deaths of that particular age group into 100. Next one is the survival rate. Survival rate means proportion of individuals who remain alive after having the diagnosis or a treatment of a particular disease. So number of patients alive after 5 years and total number of people diagnosed or treated into 100. Then standardized rates. Standardized or adjusted rates means we are having different age structures. We are having different age groups. We are having different age adjustments done so that we can compare different groups. We can compare the mortality rates across regions, across certain time periods, certain demographic groups. So there can be two methods, like direct standardization or the indirect standardization. Means we can use age specific rates. If they are known, then we can have meaningful comparison over across the populations with different age distribution also. Indirect standardization means we are applying the method with age specific rates from a standard population to age distribution of study of the population being studied. Okay, so that is indirect standardization. Next we have in this infant mortality rate. So IMR, number of deaths of infants under 1 year, total number of live births into 1000. Neonat, again number of deaths within 28 days upon total number of live births into 1000. Then perinatal stillbirths plus deaths within 7 days, total births, live plus stillbirths into 1000. Now again see the multiplier factor is 1000 because we are taking into consideration a certain population. Okay. Next is MMR, maternal mortality ratio. Here we are having number of maternal deaths per 1 lakh live births. So if we are talking of 1 lakh live births, means we are considering a large population into consideration. Okay. Then is age specific, number of deaths in particular age group, then population of same age group into 1000. Sex specific means gender specific. Cause specific, again that is from a specific cause or a specific disease upon total population, it is 1000, right? Then years of potential life lost, YPL, means here we are estimating the impact of premature mortality by calculating number of years lost before a predetermined age. Means we are highlighting the burden of early deaths into the society. Like for example, in this, like the person was having who is obese, in a certain period of time he is developing diabetes, in a certain period of time he is developing hypertension. Then if the disease is progressing, he is developing the certain complications. So the individual who could have controlled his obesity and who could have controlled his complications could have lived to 75 or 85 years of age, but due to his complications, or you can say due to his negligence, he died at the age of 65. So this is the years of potential life lost. He lost his 10 to 15 years of his life due to his negligence, right? So this is years of potential life lost. Then mortality to incidence ratio. This is number of deaths due to a certain disease and number of new cases of that certain disease in a specific period of time. So this is means you can say a summary, um, where we have taken mortality rates and ratios. I'll show you in one page. Yes, this. So mortality rates and ratios, here we have written whatever measures we have studied till now. What is the purpose means what is the actual definition of this death rate, and keynotes means what are we considering, like a specific death rate can be age wise, sex wise, cause wise. Fatality rate can be the proportion of cases that are resulting in death. So this is a certain type of summary which can help you in exams.